healthcare system is broken, but it doesn't have to be. This is Revenue Cycle Optimized by Infinix Healthcare. We discuss the latest challenges in the revenue cycle space and provide actionable tips on how to overcome them at your organization.
Hello, everyone, and I want to welcome each of you to another episode. I'm your host, Stuart Newsom, and I'm very excited today to be joined by Jennifer Pfister, who's the Senior Director of Revenue Cycle at Regional West Health Services. Now, Jennifer brings with her a whole lot of experience and has been through the trenches, if you will, when it comes to navigating the complexities of revenue cycle management. I'm sure many of you out there can feel the same way, but especially during a large-scale transition. And when you consider the fact that that may take managing remote teams in this day and age. So Jennifer, how you doing?
I think we're doing great. Our conversion happens tomorrow night at midnight. So we are a day away and just excited to be moving to the new system.
Yeah.
And we're ready to go.
That's awesome. That's awesome. Well, if you want to briefly kind of tell everyone, I think your title says it all. And there are many people who also wear the same shoes as you do. But if you just have a sentence or two, just kind of describe what you do for Regional West.
Sure. So I am the Senior Director of Revenue Cycle. So patient access, HIM, coding, and billing are all part of Revenue Cycle. We have several partnerships with other companies like Infinix for billing and coding and scheduling, and then a self-pay partnership.
Awesome. Awesome. So you can tell exactly why we wanted to bring her on to talk about this subject, especially since she's, as she mentioned, going live at midnight tomorrow night. I'm sure she can't wait for that, but maybe the fun just begins, right? So,
Already started.
That's right. That's right. But in this session, we're going to dive right into the logistics and some of the challenges that Jennifer has faced while leading and training a team of 120 geographically dispersed staff members, basically on a new EHR system. This transition is very immense. And when you add to the fact that you're balancing the day-to-day operations with that, you still have to operate your business. So Jennifer will share some insights on the importance of cross-functional training, as well as how it played a critical role in her team's success. So we'll basically be discussing key strategies for remote team management, the balance between online and practical training, and why hands-on experience is crucial for preparing staff to tackle real-world challenges. So Jennifer will also touch on how partnerships with vendors can be leveraged to ensure ongoing support and training resources. So as always, throughout this session, please jot down any questions you have. We are going to have a Q&A session at the end. So we're very excited to dive right into this important conversation. So I'm just going to get started. So Jennifer, right out the bat, to start off with, can you give us an overview of the EHR training you've managed, particularly the scope of it, and how did it involve your 120 remote staff members?
Absolutely. So training for Rev Cycle, I will say transitioning to the new EMR it's been a really great experience. We had to think outside the box just because of our partnerships, and staff are not on site for billing, coding, and scheduling staff, and some prior auth functions. They are all remote. So the training did start out with the idea of doing a 4-hour online and then a 4-hour practical piece of the training per class. We, of course, had to make that a hybrid. If you're not on site, you can't be in person to do that practical training. And so we sort of thought outside the box and came up with a different plan, but it certainly was a little bit more complex when you have so many remote staff. The 120 remote staff that you did mention, Stuart, is the billing and coding staff. So that is not all of the remote staff that we were also trying to train and get scheduled for. So it was definitely a huge scope for me.
Right. I can imagine. So when you consider that, so what were some of the initial challenges you faced, especially considering you were working with this dispersed team over different time zones, different different mindsets?
I would say every time zone for the United States was represented in that remote staff that we had to consider. We also had one coder that is located in England, so a huge time zone difference there.
Mm.
Also, you need to understand with the scope of these training sessions or subjects, if you will, there was about 15 classes for billing and coding. So as you look at 15 classes, that's 8 hours per class. So you can imagine the sheer volume of time that each participant would have to spend taking these classes. So when you're looking at that many remote staff, the online piece is kind of a do as you will or do as needed to get that done. But the practical piece had to be really thought about to get those scheduled, as we wanted to limit the number in that practical piece to no more than 10. So you can imagine if you've got 10 per class and you've got all these time zones to look at, and you only have 2 trainers to do all these classes, the complexity of scheduling staff was an interesting project.
Wow, I bet. And so you've also mentioned incorporating that hands-on practical labs was key to your team's success. So why did you find the hands-on approach to be more effective than purely online training? I know that answer seems obvious, but I think there's some in-depth reasons.
Yeah, that's a really good question. So I also, along with my partnership with Infinex and the great revenue cycle director that I work with, Rick, we did take these classes along with the staff. And I will speak for myself. I'm a very visual learner. So I think that's something you also have to take into account, is that every learner learns differently. And so you also kind of have to think about that as well. Online, you're just going through the module, you're just listening and you're watching. The practical lab is where you can ask questions of your trainer. Hey, I'm used to doing it this way. Why am I not seeing it in the new system, how you're training me? Or that is absolutely not going to work for us, and we need to pivot and look at our processes and figure out a different way to do things, or we need to modify how it's built. So I think that the practical lab, especially for me as a visual learner, was essential. I certainly would not learn the new system if I was not in those practical labs.
Right, right. And yeah, you're absolutely right. You nailed it on the head. Everyone consumes information differently. Like yourself, some are visual. I'm kind of that way. Someone like to just read. Some like to just give me what I need to know. I'll read it. I'll understand it. Some need to ask questions. So was there ever a disparity with those who were limited to online learning, that how did they overcome the challenges for when they did have those questions or when they just weren't quite getting it? Were you able to circumvent some of those situations?
So what we have come up with, for because we do have staff that were not able to take the practice lab. So a couple things that we did, we have recorded a few sessions that we'll be able to play back, but obviously that does not help. If you're still watching another recording, it might answer some questions that maybe kind of cross paths between the people that were in those live sessions as opposed to somebody who's watching that recording of the practice lab. As I said, we are going live tomorrow night. So another thing that we've set in place is we will heavily utilize Command Center as we go live tomorrow night and in through the weekend. And for 6 weeks afterwards, we have working sessions that we have set up for every piece of revenue cycle, whether it's registration or whether it's billing. They are daily. They are long sessions, but each biller will have an opportunity, especially when you're talking about billing and coding, to log in because they are remote and have that live Teams meeting or Zoom meeting where they can ask questions while they're in the live environment and doing their job for a good 6 weeks. So we've kind of put that in place to help as we go live.
Great, great. Yeah, I'm glad you mentioned that because that was something I was going to ask you as well. Was okay, what, like I said in the beginning, now the fun begins, the party starts, and all the prep work that you've done, everything that's led up to this moment, even the training and all the exhaustive training that's been done. There's still nothing like live action, right? And you never know what's going to come up. So it's almost like, okay, what hiccups, can be anticipated and how can they be remedied? You really kind of touched on it, the fact that they will be able to have, ask live questions at least for 6 weeks. So that's very beneficial. Do you anticipate, is there any nervousness on the team? Does everybody feel confident? Is it?
I think absolutely there's nervousness. I mean, certainly going to speak for myself. Of course, there's nervousness because your efficiency in a new EMR system basically is based on repetition. How many times do you get in and you do something? That's how it sticks in your mind. I would be, for lack of a better word, I'd be crazy to think that I am going to be efficient in the new EMR system by doing, 8 hours basically of classes, even with that hybrid of online and practice lab. I can tell you 200% right this moment, I'm not efficient. And I have gotten back in to the new live EMR session multiple times. I've tried to kind of call back my training. I've accessed my training that I've done over the last 6 weeks, and I still have questions, and we haven't gone live yet. And so I am nervous. But some of that nervousness also too is not just going to an EMR system as we spoke. It's also, AR rundown. As you're aware, your AR leaving from a previous system certainly does not go away the minute you go live with a new one. So you're kind of running that dual system. And so I think my nervousness is on many different levels.
Right, right. Because you do have to have that dual system, even though there's the merge. I know data transition. I've been in this business for 29 years, and I know that's one of the main things when you change, to a whole new system, which is really one of the deterrents. It's such a pain to change. People just stick with those old systems. I like to say it's like the 90s called and they want their EHR back, so it's kind of
Yeah.
time to upgrade. So, but you just have that stickiness because it is such a pain. And part of that pain is this data migration. And it doesn't matter if it's an EHR or any other system. That is a big deterrent because sometimes the fields don't match up quite right. There should be standards in place. There are standards in place, but we all know no one follows the standards exactly. So there's going to be some matching that has to be done. But, through all that, it sounds like all you can do is prepare for the best and the best case scenario, still anticipating there's going to be hiccups. So having that duality between the two systems, I was going to ask you about that too. So I'm glad you mentioned how that's going to work for you.
Yeah. So when you're looking at going to a new EMR system from a previous EMR system, you do a lot of conversion. And, let's be honest, there's never, even if you do an automatic or a auto through an interface conversion, it's never 100%, and you always verify. So from a charge perspective, we will do a conversion out of our old EMR system into our new, but then you got to kind of work in two systems. You got to have one up on one screen, one up on the other, and you got to verify. You have to verify the build and that you built it correctly. And also to remember that you need to remember that you want to embrace the new processes. And I think a lot of times change is hard. And you don't want to get stuck in previous processes because it's really easy to say, I've done this way for 15 years. When you're talking about old EMR systems, I mean, I go clear back to the DOS billing system where it was F5, F9, F4.
Keystrokes, right?
Mm-hmm.
Before there was ever a mouse.
Yeah. And so, and we've definitely come far. And so
Right.
it's definitely working in two systems, which that does bring some complexity. So when you say, do you have some nervousness? Of course, because you got two different systems, two different processes, and you got to make sure it all flows well.
Oh, absolutely. Now going back to your team, I know your team took an interesting approach by implementing that cross functionality training that you had, especially with coders who are trained in billing.
Yes.
So how did this benefit your team's overall performance?
We haven't gone live yet, so I can say that I feel like this was in partnership with Rick. When we were discussing how we wanted to do this training, I think that it was very essential that I think a lot of times in revenue cycle, it's very easy to sit in silos. I have my registration staff and they don't need to know anything about billing, which is very unfortunate thinking because from beginning to end, we all function together. And without one piece of that, you do not have a functioning revenue cycle department. So the idea of cross-functional training, I think, became very important to us so that coders understand billing and vice versa, because they're an integral part in getting these claims paid for patients. And so while you might not have any contact with patients, you might be them through me if I have a
Right.
patient calling. You need coders that understand the world of revenue cycle. And I think that's why we took that approach is, and frankly, for a lot of my career, while it maybe was not a popular idea where I'm located, I cannot stress cross-functional ideas, education, or training has to happen. You have to have staff through the continuum that understand the full revenue cycle picture, or they don't, in my eyes, they just don't function as well. So I do believe in cross-functional training. I think that it helps give them that knowledge base to understand why something needs to look the way that it needs to look, whether it's billing, coding, registration, prior auth, scheduling, doesn't matter.
Yeah, totally agree. And now looking back, are there any aspects of the training process you would approach differently to make things smoother?
Well, I would say this has probably been the largest scale implementation of the training process that I've ever done. I would probably start months earlier. What I thought would not be as complex as it really became a huge part of my day daily to make sure that the scheduling of all of the practice labs was going to work for everybody. I'm in mountain time and our trainers were available from 8 to 5, Monday through Friday mountain time.
Mm.
And so when you have to look at where everybody was geographically located, it made that very complex. And then you also add in there the complexities of, hey, let's be honest, there's a lot of staff that have younger kids that would need to be picked up, from daycare earlier. So there was a lot of schedule, rescheduling. And so I think if we had started earlier, I would have felt more of a comfort level because I feel like we kind of got to the end of getting everybody scheduled and that was a mad dash. So I think one of the major things I can take away from that is we needed to start sooner.
Right, right. That absolutely it seems like there's never enough time. You know,
Right.
and time seems to be the one thing that's the most equitable thing everybody has, right? It's just
Yeah.
how you spend it. But yet we always run out of time. So,
Yes.
well, and with that, I know that during our prep for this, you have mentioned implementing some ongoing learning through what is called the ULearn platform.
Sure.
How has this platform helped your team, basically?
So the ULearn platform is part of the initial training. That is where our online pre-class before the practice labs were located. That ULearn platform will be available for anybody that we have to onboard after we go live with our new EMR system. The ULearn platform also houses any online training that either basically that's offered for our new EMR system. So we will continue to utilize that. What we've implemented going forward is just reiterating to staff that this is a resource that they have. We've also implemented the idea of where we can house some of the videos that we captured from our practice lab training. We're trying to get that set up so that staff can access those moving forward. We also have the opportunity within our actual EMR system to have short videos that are also located actually within the EMR system, like modules that they can access, especially when you look at updates or new staff onboarding. So we're trying to make sure that we keep the most up-to-date education available to any staff member.
Nice, nice. Yeah, it's important to invest in tools like that to make sure that everyone can perform their jobs. And if there is a question or new developments, they become aware of that. Keeping informed is so crucial with anything. So glad to see that that was implemented as well. Very good.
Yes.
Jennifer, I really thank you for sharing all your insights with us. We're now just going to open it up for questions. I do see at least one question in there, Jennifer, and it's Sounds like it comes from someone who's in a similar role as you. And it states, for leaders preparing for a similar large-scale implementation, what advice do you have on planning and executing effective training? Maybe answer that beyond, kind of what you've already covered for the last 20 minutes or so.
Sure. So I would definitely say, think out of the box, think large scale, think you've got to start that training conversation pretty early on. That would be my recommendation. Think about, I will say, as I was implementing the training schedule and working through that, that's when I thought about all of the geographic areas. Have that on your list right away from the very beginning, because some of the things that came up or the requests to reschedule classes, I hadn't even thought about that. I think it's definitely knowing your staff, where they're located, through the partnership with Infinex. I didn't know where some of those coders were located. And so it was very eye-opening that in the very beginning, when we started discussing it, I had not thought of that. So I would just make sure that, you're really thinking ahead.
Right. So it really does sound like Infinix played a key role in this for you.
Absolutely. Without the partnership and co-working with Rick, it certainly would not have come together. While I might have done a lot of the organizational pieces, it is a constant communication that I have with Rick daily, every other day. We have an open line. Even in the practice labs, it's pinging stuff off of each other, and he is very knowledgeable. And so what he brings to the table, certainly I would not have been able to complete my job without him. So absolutely the partnership.
Yeah, because I think one mistake a lot of people make is they just depend upon the vendor to hold their hand through the whole process. And we know vendors are certain competitors. Certainly the vendor you're leaving may not be as cooperative, even though I know it's best to leave politely and to leave on good terms, because you never know when you may be back. However, the new vendor, some people just depend on that vendor. Hey, walk me through. But as you've illustrated here, it does take someone, like Rick and his team, to hold your hand through that process and think of things that you probably wouldn't have thought of, or even the vendor wouldn't have thought of based on your particular situation.
I think you hit the key right there. And I want to be very clear when you're talking. And that's why, honestly, I know it sounds odd, I don't ever use the term vendor. I truly think that I have a partnership with Rick in working through our billing and our coding. And you have to. I have a partnership with myself, if you want to call it your self-pay vendor. I have a partnership with the new EMR system, just like you need to have a partnership with your previous. You really can't look at them as vendors. I think for me, I guess the way that I look at it is kind of a negative connotation. It
Right.
has to be a partnership. You have to work together with good communication, or it will not be a successful implementation.
Yeah, exactly. Couldn't agree with you more. Partnership, and it's about relationship. And that's one of my tenets is it's relationships and really listening and caring for, a problem that your client may have and how can you help with that problem. So, well, this has been an awesome time, Jennifer. Really enjoyed having you with us and you sharing your insights. We hope to have you again sometime.
Thank you very much for having me. I appreciate
Awesome.
it.
Awesome. And with that, I hope everyone has a great day and thank you for joining us.
Thanks for joining us. Subscribe to get notified when our next episode is online. For more information for how we can help you increase reimbursements at your company, check out our website at infinix.com. That's INFINX.com.